Welcome, Joseph and Margaret. We're just going to wait for some others to join. We've had a bunch sign up, so we'll give a few minutes to everyone maybe grabbing lunch at this time. Thanks for using your lunch hour to join us today. Joseph is definitely grabbing lunch. Oh, I thought you were gone from that background. Are you in an actual office there, or is that a background?
No, they took my desk away at the office. So yeah, this is fake back here.
I have the same. I have a picture of my old desk that I sometimes use as a background. It makes me feel nostalgic. That's why I asked. I used to sit right there, right? No. All right, we'll wait a couple more minutes. Well, we had close to a dozen people sign up in advance to be here today. So appreciate the time that you're giving here, and out of respect for that, we'll go ahead and get started. This session is being recorded, so we will be able to share it out for a more general audience for those that weren't able to attend, or for others that you were hoping to share it with, even with inside your organization who might not have been able to be here today. So thanks, Margaret and Joseph, for joining us. I am Sarah Regal. I lead up the school-based partnerships team here at Public Health, and I'm joined by three of my colleagues, Erin McDougall, Samantha Yuen, and Sema Omaran, and they are going to be supporting the process of this RFP going forward, and I'm here to share a little bit about what to expect and we're hoping to fund. So Samantha, can you share the screen and the presentation? And we can get started. Welcome, Cheryl. We're just getting started. We're about to share the presentation. Samantha, can we assist you in any way? Are you ready to do that? I can't hear
you. Keep talking with my phone with my mute button on. I don't know what just happened. The share button does not allow me to share. Okay. Oh, there we go. Got it. Can you guys see?
Perfect. Yes, we can. Let's go ahead and start that.
Awesome.
So what I'm going to share with you all today is a little bit of an introduction to both Best Starts for Kids, our work as a program team, and how this investment then fits as a part of our school-based health centers investments in King County. Some of you may be already familiar with King County, or with Best Starts for Kids, but I want to provide this overview, and that you might know BSK is an initiative to improve the health and well-being of King County by investing specifically in promotion, prevention, and early intervention for our children, youth, families, and community. It's a broad goal, and there are lofty opportunities here, but Best Starts is rooted in the fundamental belief from within King County government and across our communities that our county is a region of considerable opportunity, and that we all will benefit when each and every King County child, youth, and young adult is supported to achieve their full potential. It's really great to be a part of this strategy. School-based health centers have been around in King County and in other places around the country for more than 30 years. And Best Starts investing in this work to expand it is extremely important. Next slide, please. So this investment is grounded inside the school-based health center model. So I want to make sure that we're all grounded in what is the school-based health center, understanding some of you have direct experience with this, but for those that don't, a school-based health center is defined as a program site or clinic where comprehensive primary medical care and behavioral health services are provided. It may also include dental and additional services like nutrition education and health education. And they're provided there in school settings to children and adolescents. School-based health centers are an effective strategy for increasing students' educational and health outcomes. And as I mentioned before, our first King County clinic opened in 1990 at Rainier Beach High School in Seattle. And there are currently now 35, I think, school-based health centers in our county. And Best Starts, part of our recent investments has been to invest in 2 additional sites that will be opening this coming fall at Highline High School and in Mountain View High School. Right now we have 17 high schools, 9 middle schools, and 8 elementary sites. Majority of those being in King County, but as I tell you a little bit more about our Best Starts investment, we've been able to expand that to now 5 Best Starts for Kids invested sites outside of Seattle. Next slide. And our program work is really implemented by our team here at Public Health. We provide the funding and coordinated support to the system and this whole group that implement the work. And our grantees and current folks providing the services directly are these 9 healthcare organizations listed below. So it's a really great diverse group of healthcare providers that include federally qualified health centers and nonprofit hospitals. And everybody brings a bit of a unique piece of their own work into this model. And yet there's a shared vision and sense of the way we operate the school-based health centers and partner together. Next slide. And as I described, really primary preventive care and mental health are really the key cornerstones and the 2 primary services that are provided in our school-based health centers. And that includes things like immunizations, routine sports physicals, and reproductive health care, but also can include health education, care coordination, dental care, gender affirming care, and other clinical supports for students who may be managing chronic medical or mental health conditions alongside a community-based provider. Next. And our program here at King County, although we are the funder of some of this work, we have and hold the vision that all children and adolescents are healthy and ready to thrive in the classroom. And we do this very clearly by promoting evidence-based quality care to students, and to accomplish our work through a systematic approach to partnerships and collaborative leadership, both between schools and the school-based health centers. So we work to sort of engage between the school programs and the healthcare providers. And lastly, our mission is to also achieve measurable results for student health and academic outcomes so that students thrive. This is very closely aligned with the BSK missions that are the overarching results that we hope to achieve, in that babies are born healthy. King County is a place where everyone has equitable opportunities and access to safe and healthy programming as they progress through childhood. And lastly, communities offer safe, welcoming, and healthy environments to help improve outcomes for everybody. This slide is also our program goals and the outcomes, which again align well with the Best Starts goals. Next slide. There are a number of benefits that we know from decades of literature that have been produced around school-based health center work. Benefits for this includes increased school attendance, reducing barriers to learning, very conveniently saving parents and employers time so that we're not taking students away and out of class for regularly scheduled doctor's appointments. And it supports teachers and the school personnel in the community in getting access to services, supporting their students to get them back to class in a more timely way. It has been shown to increase school connectedness for both students and school staff, and a unique way to engage parents and the community in the school work. Next slide. Other outcomes that have been well documented around on the medical side are decreased emergency room and urgent care visits, decreased hospitalizations for children with asthma specifically, increased access to and yet use of mental health services, improved vaccination rates, and reduced Medicaid expenditures. Our Best Starts for Kids school-based health center investment, as I mentioned before, the top bar here in blue or purple is the 1.0, the first iteration of Best Starts for Kids, which was running for the last 6 years. We invested in new clinic sites in Renton, Bellevue, and on Vashon Island. And those were communities that were brand new to school-based health centers that were able to develop. Those sites will continue to be funded in the second iteration, as we call BSK 2.0. And as I just mentioned, we just finished up an RFP process where we awarded 2 operational grants to medical providers to provide and open services in the Highline School District and in Auburn. The last piece is what we're here to talk more about today as I drill down a little bit more and tell you some detail. This is what we have been called our enhancement investments. And it's really to support system enhancements around equitable and culturally relevant service provision, data systems, professional development and training, and program evaluation. It's a large bucket of work with a small amount of funding, modest amount of funding, and I'm going to tell you a lot more about what to expect from this piece, but I wanted to just sort of frame all of that as we talk a little bit more about this funding opportunity. Next slide. This is just a snapshot of our work in the last, primarily those 3 new clinic sites that we established. So the number of student users and number of visits that have been provided by those clinics. So you see obviously a decrease in the 20 and 21 school years during the pandemic time, but the difference between 18 and 19 was a steady increase in those students served. So, you know, 6,500 individual visits for those 3 school sites represented here. And while academic outcomes were affected by COVID school closures, you know, prior evidence demonstrates important improvement in mental, behavioral, and physical health and academic outcomes. Most of our clinics did stay open during the 20 and 21 school year, so they were still able to see a number of students and offer telehealth as well. In BSK 1.0, we measure success by asking ourselves a couple of key questions. Primarily, how much did we do and how well did we do it? And those are simple questions with sometimes complex answers, but how much is really just that graph that we showed, how many visits and how many students individually access services at the school-based health centers. And how well did we do it, where we have a variety of performance measures, some of which have to do with standardized performance measures that we use across all our school-based health centers, encouraging every student who's seen to receive a standardized risk assessment, to be screened for depression and receive appropriate counseling, and to be screened for drug and alcohol issues and receive brief intervention and or referral. So these are a little bit about how we did. Providers saw a rise in demand for basic needs during the pandemic and also shifted support to address immediate concerns while continuing to provide students with medical and mental health services and primary care. This is just a little quote from one of our partners about this last period. We asked folks to report every quarter with both a narrative, quantitative, and qualitative reporting process. So the most important success we had during this period was being able to develop and implement telehealth for our students so they could access services. So many of our students were dealing with anxiety, depression, grief, and debilitating fear. Our team was able to create an online space for them to give them tools and support to move forward, even with all of the uncertainty. And the inclusion of telehealth is now something that's really standard in the work, and we hope will continue despite students returning to in-person school. It will be an option. So let's dig in a little bit more about our Best Starts for Kids investment, and particularly why you came here today and what the opportunity is that you want to learn about. So this graphic kind of represents the total Best Starts for Kids levy across all years from 2022 currently running through 2027. The first two hexagons, I think these are, shapes that we see in the blue and the orange. The blue one is those 2 new clinics that I've mentioned a few times that will provide operational funding for, as well as ongoing funding for those 3 that we funded the first time in BSK 1.0, Bellevue, Renton, and Vashon. The orange box is a comprehensive data management and evaluation system that we're trying to stand up and support our entire system to have a more cohesive way and an opportunity to share data and represent our performance across the system. And these last 3, all in green, are really part of the enhancement bucket. So what we're going to talk about today is an opportunity to support training and professional development, increased equitable access to services, and to strengthen our systems and service delivery. So this is our next phase where we are for investments. Investments for these buckets are an extension and an expansion of our school-based partnerships program. With this additional funding, we are expanding on the following services: advancing health, equity, social justice, and anti-racism among school-based health center staff to improve health outcomes for BIPOC or LGBTQ students and communities. Expand school-based health center options for equitable access to mental health, health and behavioral supports, including substance use prevention and treatment, and strengths-based, inclusive, community-based programs. And to embed and evaluate the implementation of culturally sensitive healthcare and hiring practices in school-based health centers to increase language access, referral, trauma-informed approaches, and person-centered care. We do this primarily through a contract that we have with the University of Washington Mental Health Services to provide consultation, and for University of Washington School Mental Health and Evaluation and Research Training Center, the SMART Center, to define what we do for school-based health center services. The funding available is listed here below. The first year, there is a limited amount of funding as compared to the years following, due to the fact that our timing for this RFP will begin mid-school year. So we typically work on a school year cycle. So when we say year, we mean the school year period from September to August. And so we will begin this funding with implementation in February 2023. So those contracts would run from February through August with a ramp-up period. And then beginning in September 2023, the full opportunity of $415,000 is available for subsequent years in the remainder of the levy. Okay, so our application requirements, eligible applicants here will include the healthcare agencies that are currently working in our school-based health centers. It may also include school districts and or community-based organizations. The important part here is that the proposed activities must be in partnership with an existing King County School-Based Health Center and sponsor agency. So as this is slightly different than in years past, where you may have applied for enhancement grants, where we previously only made eligible current school-based health center providers and partners. In this case, we're expanding the eligibility of applicants, but we're requiring that that partnership look really cohesive, and that the goals of what you propose are about the partnership and approach to serving students in those spaces. Next slide. I did share these before. There's a lot of words, so I wanted to make sure there is a slide about this, that what our funding goals really are inside of this work. In response to racism as a public health crisis, these are some of the ways that as a school-based health center system, we might be able to advance equity, implement culturally sensitive healthcare services, and really provide equitable access to mental health and behavioral health supports. So the proposed ideas that you would be applying for would have to think about how they would apply to meeting these particular funding goals. I'll pause just for a minute and be welcome to take questions. I have two pieces left to show you. One is a example of some of our work in school-based health centers via video, but I would be happy to take questions now, either in the chat or feel free to unmute yourself. Okay, go to the next slide. Yeah, you want to see the list of current partners again? Margaret, we can do that before we close, but thanks for asking. I'll let you know who they are. So this is a video, particularly, let me just frame this up before you hit play, that was created by International Community Health Services, who's one of our strong partners, and Cheryl Gray here is representing that team on the call, so thank you for that. They produced this really fabulous video to celebrate the 10th anniversary of their work at the Seattle World School Teen Health Center. The work there is a bit unique because it provides services and supports to students in a school who are entering the country into our American education system for the first time. But what they explain and describe is really about the heart and the services that are supported at all school-based health centers. And it's just a really lovely piece to highlight the work of folks doing this on the ground and to see where opportunities might be to intersect. So we're going to play just a portion of this video and you all can see about the great things happening at the Seattle World School. Thanks. Go ahead, Sam. Y'all can hear music? I confirm. Thank you.
That looks great.
For over a decade, International Community Health Services has provided school-based health care to students who need it the most. Young people newly arrived from all over the world. Newcomers who've become part of the Seattle World School.
We were very much in the traditional model of healthcare in this country, seeing your patient for 1 hour of therapy and coming into the clinic and just to get the medical concern taken care of. But this, I think we realized that this wasn't exactly meeting the needs of our students, that this model didn't really fit their needs in the same way, and that people weren't actually coming in.
Hello, this is Teen Health Centers. How can I help you?
In 1980, Seattle Public Schools established the concept of the World School. Like all Seattle public schools, the Secondary Bilingual Orientation Center provided site-based health care.
Oftentimes, students who have just arrived here have not ever had a physical exam, maybe no dental care. So when they arrive here, we try to explain what it is we do here at the clinic.
It was clear that more needed to be done to help students who've had little to no health care in their lives. Visionary school nurse Helene Mansfield saw the unmet needs. She recognized that these students needed so much more. Mansfield was determined to change things. Through her hard efforts over 2 years, ICHS was awarded the contract to deliver enhanced school-based healthcare in 2011.
I was scared because it was a flu shot, but that's when I met Didi, and I started asking questions to Didi about the flu shot because I don't remember getting flu shots back at home, and then she will explain everything, like what was important to get a flu shot, that it was the season, and that I had to be protected. Since Didi spoke Spanish, she was able to communicate with my mom as well, and that was really important for me.
CeeLo Martinez is one of the many students who've come through the Seattle World School and bonded with the health clinic staff. The staff made her feel safe and understood as a first step in serving her health needs. Being culturally sensitive to students is essential to the mission.
We can see the students' faces just light up when they ask or they hear us respond in their native language. They just like they physically just appear to relax and feel just more at ease, safer, that they're going to be able to communicate what they're trying to say without feeling like some things might get lost in translation.
Over the decade that the ICHS clinic has served students, by far their biggest challenge was dealing with COVID-19.
I think that's where we
With
want to stop.
schools in lockdown, the world's
Thank you. It's such a beautiful video. Maybe I can link to it later. But thanks to ICHS for creating that and sharing that with us, and allowing us to share that with all of you as a snapshot, as an example. Let's go to the last slide. This is a chance just for us to have a conversation and discussion.
and emotional.
Are there any questions? I think there was one about our current partners, which I can also share back up.
There's a
Thank
there's
you.
a question in the chat. Sorry to
I
interrupt.
have a long-winded question in the chat.
Okay, I'm going to do my best to read it, or Ryan, if you'd like to speak, I would be happy to hear it from your voice again.
Yeah, I can speak. I just didn't want to take up everybody's
No
time.
problem. That's what we're here for. Thank you.
I work for Bridges. We are an alternative peer group. We work closely with the Recovery High School on Queen Anne. And basically what we do is we facilitate a safe space, and we have a certified peer counselor and a peer-led space where teens that are in, the developmental stage going through high school, which is hard enough as it is, where they can do that in recovery with others that are their age, which is pretty hard for them to find in other spaces. I'm wondering if we worked with a school-based agency, would we be somebody that's eligible? Because one of the things that really I noticed that substance abuse referrals were much lower than some of the others on the data that you offered.
Yeah, so you would be a qualified agency as an applicant, but your work and the proposed work must partner with or be supported in a school that has a school-based health center. So in that setting. So if you're talking Seattle, it's one of those 29 sites. It's all the comprehensive high schools plus interagency. Is your program part of interagency? No, it is, right?
Interagency on Queen Anne is who we close
Yeah, okay. So if that's a relevant connection, or there are other schools that you'd want to partner with, you would want to think about how your services directly would support and be an enhancement to existing work that interagency has with Kaiser as the partner there. So you'd want that to be a sort of a cohesive and partnered application.
Excellent. Yeah, I work closely with Seth up there anyway. So
Yes.
it'd be really easy for us to put something together.
Thanks for that question. Thanks for being
Thank
here.
you.
Yeah. I did post the list of current partners in the chat. And we also have on our website, maybe that is a good place to list which partners provide services at which schools. So it might be useful for you to see who you may want to partner with across the county. Any other questions? And the link I'm going to put in the chat there is the list of all the school-based health centers in the county, organized by agency sponsor. And there's also a map, geography, you can look, see who you want to partner with.
Sarah, this is Cheryl. I'm having
Yep.
a little technical difficulty. Can you hear me? Okay.
Yeah, you're in and
I'm
out a
just
little
curious,
bit. Go ahead.
how many projects are you? Okay, I can put it in the chat, but how many projects are being funded? I don't know if you heard that.
Great. I think there is, my team can help me make sure I'm verifying this correctly, but there's an expectation the total amount funded may be higher than in previous grants. So it is likely to be 2 or 3 grants rather than a smattering of more lesser grants. So the total amount available is just over $400,000 in the second year. The first year would be less, so there'd be a ramp up period or description of services that could be provided in the shortened time period of the school year. And then Margaret's asked, and I think Allie's question is similar. Do we need to provide enhancements in all three of those areas, or is there a funding preference? I think Allie, your connection or your question is similar to that. So no, not all three. You can choose to focus on one of those areas. Yes. Does that answer your question, Allie? You may be proposing a very specific aspect of care too. I don't think there is a preference. I think it's about how you want to determine and define needs and opportunities that would support the goals. Happy to hang on a little bit longer and just pause and wait to see if something else comes to mind as you're here thinking and listening and considering this opportunity. Anyone else from public health team want to add any other detail? Our funding timeline and application deadline. We are refining an actual date for you right now because we have heard from many of the current school-based health center providers about our proposed date. So right now we're looking at a release date in October. So we're chatting with you all now so we can think ahead through the summer and start some planning, and we would have 6 weeks for the application to be open, and would expect to have grants and contracts in place by mid to end of February. And all of the timelines and RFP dates will be posted on the Best Start for Kids website. As we're updating that as a team, it will get updated soon. I believe right now it's stated publicly as September, but we're trying to move that off of the first couple of weeks of school and release that a little bit later so you have some more time to partner with schools and digest and plan and work towards that application. I'll be happy to hang out here if you have any other lingering questions for just a few minutes. If you had your questions answered, you're welcome to go or maybe attend another session upcoming today. There are a lot of opportunities being presented in the open house. So I hope you'll take advantage of that chance to learn more about other BSK investments.
I just want to say thank you so much. I'll see you next time.
Thank you, Joseph. Thanks, Allie. Thanks, Ryan. Bye. I stop the recording. Yes.